All right, so we've discussed biodata, we've discussed the presenting complaint. Now, let's move into the real deal. So now the next thing after your PC is you want to write HPC, which is the history of the presenting complaint. Now, this is now where you start taking details about the patient presenting complaints, the things that they mentioned. Oh, cough. Now you have to talk about the cough, everything about it. Oh, they mentioned that they have chest pain. Now you have to discuss about the chest pain. Now, mind you, if I start discussing in full details and start giving examples about every symptom and how to collect them, we will not leave here today. I remember, like I said, this video is basically like something that will give you a broad picture as to how things should go, but there are specific ways of asking questions about each kind of presenting complaint, and I'll advise you to check some textbooks as well as some very handy books like probably the guide or principles. And sometimes our consultants don't like us having those books. All right, of course, the golden book for clerking is Hutchinson's. I'll advise you to study your Hutchinson's manual, chapter 1, for history taking. But remember, sometimes you also need to have something really handy that you can just open and just quickly check one or two things. And the guide and principles will really help with that. All right, for both medicine and surgery. Okay, so your history of presenting complaints, there's a systematic way of asking questions regarding this, and there's a particular very popular system we use in mnemonic called 5 C's. The 5 C's, like C after A and B, C. All right, we have the 5 C's, and the 5 C's are: number one is character of the chief complaint. Character of the chief complaint. Number two is the course. The course, COURSE. Number three is the cause, that's CAUSE. Number four is complications, and number five is care. So your history of presenting complaint is going to follow this pattern. All right, you're going to follow this pattern, and we are doing this based off the symptoms or based off the presenting complaints that the patient has listed for you. Okay, so it's going to be done systematically. Your history of presenting complaints is what I'm going to talk about now. All right, remember that the golden rule about history of presenting complaints, you're using 5 C's: the character of the chief complaint, the course, the cause, the complications, and the care, and you must follow that manner. That is, the care must be last, and then the character and course above, and you have the cause. So character, course, cause, complications, and care. You must always follow that pattern. All right. So now I'm going to be taking character and course together. Okay. So for the character and course, to talk about that aspect of the 5 C's for a particular symptom, for a particular presenting complaint, there's a mnemonic for that. In medicine and surgery, we try to make mnemonics for so many things because it just makes it easier, and with time it will become all right. Good. So character or course. For the character and the course, I said I'm taking them together, and there's a mnemonic we use to talk about the character and course with particular presenting complaint. And the mnemonic is called doctor. DOCTOR, doctor. All right. There's a different mnemonic, which is Socrates. 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 Now, we use Socrates when the complaint is pain related, and we use doctor for every other complaint that is not pain related or that is not pain. Do you understand? So, doctor and Socrates, they're able to qualify the character and the course of the presenting complaint. Doctor and Socrates. Socrates is pain, any kind of pain, chest pain, back pain, whatever it might be. Pain is for Socrates. Use Socrates when you're dealing with pain, and then use doctor when you're dealing with other things. All right. So what does doctor mean? What is the mnemonic doctor all about? So D is for the duration. O is the onset, C is the character and the course, T is for the timing, and OR is for other related symptoms. OR is for other related symptoms. All right, so I'll quickly talk about doctor before I move to Socrates. So doctor is DOCTOR, duration, onset, character and course, timing, and other related symptoms. Okay, so remember, for your history of presenting complaints, you are writing it out. So you're writing out your history of presenting complaints. You're trying to fashion into a very organized form. Okay, and I will give you an example when I'm eventually done with the HPC. I'll give you an example of how it is written. But for now, let me just discuss the things that it should entail. All right, so the duration, the patient tells you, oh, the presenting complaint is cough. So you're asking the patient, well, please, when did you notice it? When did it start? So that's the duration. Oh, it started 2 weeks ago. So that means the duration is 2 weeks. Oh, I noticed it 4 weeks ago. It started 4 weeks ago. The duration is 4 weeks. Exactly. So that's duration. Now, the onset. What is onset all about? So onset is, how did you notice it? How did it start? Was it gradual or was it sudden? Do you understand? So the onset is, how did it begin? So you had cough. How did you notice it? How did it start? That's what you're asking. Did it come all of a sudden or was it gradual? Do you understand? So if someone says they have cough or they have any symptom, you're asking and you're following doctor and you've asked for the duration. O is the next thing, that's the onset. How did it start? All right. If someone says they have breathlessness, how did it start? Was it gradual? Was it sudden? They can respond like, I noticed it when I was trying to climb the stairs. Just found that I became breathless when I got to the top of the stairs. Or I noticed it when I was trying to carry something. It put a lot of strain on me. Do you understand? So how did it start? What were you doing when you noticed it? All right. And then inside that onset, you're still asking, did it come all of a sudden? Or was it something that was gradually? All right. So that is onset. How it started, how they noticed it, and was it gradual or sudden? And all these things have to be imputed into your HPC. So that's about O. That's still on doctor. Now C is the course and character. Now talking about the course means that since this symptom started, has it gotten better? Has it gotten worse? Or has it remained the same? So you're asking about the progression of the complaint. So has it gotten better? Has the cough worsened? Has the cough gotten better? Has it resolved a bit? Or has it been the same intensity all through? You're asking that. That's about the course. Still on the course, you're asking, is it something that happens all the time? Or does it come and go? Come and go. All right? You're asking the patient. I remember as you are talking to the patients, you're asking the patient these questions, you're trying to relate with them. You're using English that is relatable. You're not using big terminologies. You're not saying, sorry, ma, is it continuous or intermittent? No. That's not what you're doing. You're asking, oh, ma, does it happen all the time? Or does it come and go? Does it come and go? Does it come and go? Do you understand? So your course, you're asking about the progression. You're asking whether it is continuous or intermittent. So for the progression, you're asking, has it gotten better? Has it gotten worse? All right, has it worsened or has it improved? Or has it remained constant? Has it remained the same? And then you're still asking, inside that course, you're still asking whether the symptom is a continuous one or is intermittent. Does it come and go? Does it come and go? Then for the character, you have to characterize the presenting complaint. That complaint, you have to characterize it. You're talking about the quality or the nature of the complaint. If they say they have cough, you're asking, do you bring out something from your mouth when you cough? Is it productive or non-productive? You're asking about the color of the sputum. What color is it? Is it green? Is it brownish? Because It plays a role. It's important in your diagnosis. All right. You have to know all of these things. It's important in your diagnosis eventually. All right. You're asking for the color. You're asking for the odor. Does it smell? Is there blood in the sputum? So all of these things that we're doing, we're trying to characterize the symptom that the patient has said that they have. All right. So, like I said, there are several ways of asking questions. There are several questions you can ask depending on the chief complaint or depending on the symptom. And that's why I said you can check your Hutchinson guide principles. They have all these things outlined. I won't dive into all of that. All right. But just remember that the character is color, odor, is there blood in the sputum? That's, for example, if somebody has a cough, you want to characterize that cough. Understood? Now, T, the timing. So you're asking the patient, this cough that you have, do you have it more in the night? Is there a particular time of the day that it happens? That's timing. Is there a particular time of the day that it happens? Does it happen only in the night? Does it happen during the day, or does it happen throughout the day? Do you understand? So the timing is also important. That's what T stands for. Then OR means other related symptoms. OR, other related symptoms. Other related symptoms can be any other thing that is associated with that particular cough. Does the cough come with fever? Does it come with difficulty in breathing? Is there vomiting? Is there loss of appetite? There are so many other symptoms, and this is why I mentioned earlier in your PC that there might be some symptoms. Once you see that the patient is having a lot of complaints, do not let it exceed 5. There are some things that you can lump into the other related symptoms. So that is doctor. Now for Socrates, I remember I told you that Socrates is for pain. When it is related with pain, like chest pain, back pain, whatever it might be, you use Socrates. S stands for the site. S is site of the pain. O is for the onset. C is for the course and character. R is does it radiate? Radiation and relieving factors. All right. A is aggravating factors as well as associations. T is for the timing. E is for the end of the pain, and S is for severity. And of course, I will go through all of these things. So for the pain, if the patient says that they have chest pain and they say they have chest pain, you've already asked, when did you notice this? When did it start? Oh, it started 3 weeks ago. All right, so that's the duration, which is a must do, something that you must have even done in your presenting complaint. So the S, site. You want to ask the patient, where exactly, Mark, can you touch the place for me? Well, I'm having it here. The chest pain is central in location. Oh, I'm having it by the side here. Do you understand? So you have to know the sites. I'm having pain here. So it's in the epigastric region. I'm having pain in this side. So it depends on the location. That's why site is important. Okay, so site, you have the site. All right, O is the onset. I've mentioned onset. You're asking, how did you notice it? How did it start? Is it gradual or sudden? Then C, I've mentioned about C, which is the course and the character. All right, course, you're talking about the progression as well as whether it is continuous or intermittent. Right? Then character, you're asking, so for example, for the character, if someone says they have chest pain, okay, can you help me to characterize it? How is it exactly? Is it a tearing pain? Is it as if something is on your chest? Is it like a heavy feeling? Is it a crushing feeling? Because all these characters are super important when you're trying to diagnose the patient. For example, if somebody is having a crushing pain, a crushing kind of chest pain, it can indicate myocardial infarction. So all of these things are very important. So you want to know the quality, the character of that particular pain. Is it a heavy pain? Is it a peppery pain? Is it piercing? Is it tearing? If it's a tearing pain, it can be something that has to do with the aorta. So you have to know what you are doing. All right. Is it a dull pain? Is it a crushing pain? Sometimes they say it's as if somebody is stabbing me. So it's like a piercing pain, like a stabbing pain. So you have to characterize the pain. All right. So that's SOC. Then the R is radiation. So you're asking the patient, does this pain move to any other part of your body? Does it radiate to any other part of your body? All right. If they say yes, oh, where does it go to? It goes to my shoulder. So you would mention that, oh, there's a chest pain, definitely radiates to the left shoulder or radiates to the right shoulder. You have to ask, does the pain move to any other part of the body? And you have to indicate that. So that's the R. I said the R is radiation as well as the relieving factors. So you're asking the patient, is there anything that you do that relieves this pain? Some people, if they have back pain, oh, I have the back pain when I stand for a long period of time, but it gets better when I sit down or when I bend. So that means it is relieved by bending. It is relieved by sitting down. Do you understand? You have to ask all these things because it plays a role in your diagnosis of the patient's problem. So R was radiation as well as the relieving factors. A is for aggravating factors. Is there anything that you do that worsens this problem, that worsens this pain? Oh my God, when I walk from here to here, it starts paining me. So you have to indicate the aggravating factors. Or when I try to carry something, it's as if my legs are not functioning. So you have to make sure you ask the aggravating factors. Is there anything that you do, man, that worsens this pain? Right? So aggravating factors are very, very important. A also means association. A also means associations. Now, if someone meets you and they say that they have epigastric pain, you want to know the associations in the sense that you're asking, oh, does the pain come when you are hungry, or does the pain come when you're eating? So those are associations. Is the pain associated with something that you do? Is the pain associated with something that you do normally, like when you eat or when you're hungry? You have to know these things because sometimes it helps to differentiate a duodenal ulcer from a gastric ulcer. So you have to make sure these things, you know them. All right. C, timing. I've mentioned this before. Does it happen in a particular time during the day, or is it all through the day? Is it in the night? Right. Then E, end of pain. E means end of pain. Is there a particular time when pain ends, when you don't feel it anymore? All right. So that's end of pain. And then the S is the severity. So you want to ask for the severity of this pain. How painful is it? What's the pain score? That's what we call it. What's the pain score? So what you're asking your patient is, Ma, please, I would like to know how severe this pain is, and I'll need you to grade it on a scale of 0 to 10, or a scale of 1 to 10, as the case may be. 1 being the smallest type of pain that you've ever felt, and 10 being the most kind of pain that you can ever imagine. All right. So they grade for you. So you can see how I mentioned to the patient that I want you to grade on a scale of 1 to 10. And you have to tell them that 1 is the smallest kind of pain. 10 is when the pain is a lot. Sometimes they usually say that 10 is labor pain, some places. All right. So that helps the patient to be able to grade. Okay, it's paining me a lot. All right, like 10, 9 over 10. All right. So sometimes people say, it's not so painful, like maybe 4 or 5. Do you understand? So it helps you to know what we are working with. So that's really character and the course, all right, and of the 5 C's. Remember that for the 5 C's, the first 2 you're using doctor or Socrates, depending on the kind of complaint it is. Okay, so now the next thing I want to talk about is cause, C-A-U-S-E. So moving on to the cause, the third part of our 5 C's, we've done the character and the course, where we use doctor and Socrates. Now, C-A-U-S-E, the cause. Now, this is where you are trying to find out what is the cause of this patient's complaint. What do you think is the problem? What is the major reason why they are complaining of these things? All right. And when you are in this part of your HPC, you have a lot of things running through your mind. And yes, we have another mnemonic in this place as well. All right. So it's making you think about the differential diagnosis of what this patient's problem might be. And so in this part of your 5 C's, you're trying to either rule in or rule out several things to be able to identify the most likely diagnosis. So you're trying to think of the risk factors that might be associated with this patient's symptoms, to try to think of the most likely diagnosis, the most likely reason that the patient is complaining about some of these symptoms. And there's a mnemonic for it. There are several mnemonics for it. You'll find several mnemonics several places they will use different things, but the one that I feel like is all encompassing, I will use two: vitamins A, B, C, D, E, K, no P. So the mnemonic is vitamins A, B, C, D, E, K, no P, as in no problem. Or you use think and bed MIDI. Think and bed MIDI. Remember, for the course, you're trying to think about so many things. All right, so they structured it into a way that there's a systematic way you think about things that can cause this patient's complaint. All right, vitamins A, B, C, D, E, K, no P, or you use think and bed MIDI. So let's use vitamins A, B, C, D, E, K, no P. So V is vascular, I is infections or inflammation. That can be the reason the patient is complaining. T can be traumatic, it can be traumatic or toxic. A is either allergic or autoimmune. M is can that be metabolic or mechanical. I can be iatrogenic or idiopathic. Iatrogenic meaning a medical or surgical procedure has caused the problem. Idiopathic is you don't know what the issue might be. N can be neoplastic. N means neoplastic. S means social. Is it like as a result of the social behavior of the patient? A is for alcohol. B can be behavioral. C is congenital. D is drugs or degenerative. So that's vitamins A, B, C, D, E. E is endocrine. K is karyotype. N is neurologic. O is obstetric. And P is psychological. That's if you're using vitamins A, B, C, D, E, K. No P. It seems like a lot, right? So this is a part where some people might have struggles with when they start clicking. I know I did, because I didn't find it easy to think about all these things, and that's where your knowledge about pathology comes in. All right. If a patient comes to meet you with and they have cough, chest pain, fever, some things should be running through your mind. Your differential diagnosis should be running through your mind. All right. You should think of something like this. Can it be pneumonia? Can it be this? Can it be that? And then in your causes, you're trying to, oh, can it be as a result of autoimmune? No, it can't be. Can it be inflammatory? No. Infection? Okay, I can be thinking of infection, pneumonia. So we ask questions about the symptoms of pneumonia to see maybe I can rule in or rule out that particular reason. All right. But what I will advise you is that try to make sure that you collect a lot of patients, take history from them, present to a senior person, all right? Present to your consultants, present to your SRs, present to your JRs, present to anybody that you can find, and try to learn from them. History taking is an art, to be specific, because the more you do it, the better you get at it, right? The first time you do it, you will have a lot of corrections. I know I did. You have a lot of corrections, and with time, it gets better. So practice makes perfect. So keep on practicing. All right. There will be better approaches to how to go about these causes, and with time, it will become spinal. All right. Moving on to think and bed MIDI. Some people just even say think and bed. All right. But think and bed MIDI. Trauma, infection, nutritional, it can be cardiac or congenital, can be autoimmune, can be from neoplasms, can be blood dyscrasias, endocrinopathy, degenerative disease, metabolic dysfunction. It can be idiopathic, it can be as a result of drugs, it can be as a result of inflammation. So that's think and bed MIDI. So these are the things that are running through your mind when you're talking about the causes, all right, in your 5 C's. Now, when you're trying to rule in or rule out some of your differential diagnosis that will be running through your mind using this format that we mentioned, you have to mention the positives before the negatives. Now, let me give you an example, starting with the HPC of what we've talked about from the beginning, using character course, the doctor and the Socrates that I've been mentioning. When you write a HPC, after writing PC, when you write a HPC, what you're going to write now is going to be something like, patient presented to the clinic on account of breathlessness of 2 weeks duration. You already asked questions, all right? So you're writing a HPC, patient presented to the clinic. If you're in the clinic, patient presented to the clinic. If you're in the emergency, patient presented to the accident and emergency. If you're in the ward, patient was admitted on account of, that's the format. Patient presented to the clinic, or patient presented to the emergency room, or patient presented to the accident and emergency, or patient was admitted on account of. They now put the presenting complaint. On account of breathlessness, then the duration of 2 weeks duration. Then start your doctor or Socrates. In this case, it will be doctor we use, right? So you've already done duration. Now go to everything that we mentioned. It was sudden in onset, right? And now start doing everything that we mentioned. It was sudden in onset. It was noticed when the patient was doing so and so. All right. If I use something like pain, patient presented to the clinic on account of chest pain of 4 weeks duration. All right. The pain was sudden in onset. Cause and character is next, right? Pain was sudden in onset and was said to be a stabbing pain which radiated to the upper arm or which radiated to the left shoulder. There are no aggravating or relieving factors, or the pain is aggravated when the patient does this. For now, follow that way. That is how you do it. Okay, with time, it will get better. With time, it will become more interwoven. It won't be like this always, all right? But for now, because we are just starting, because you are just starting, all right, this is how we're going to do it, okay, because you're just starting. With time, with practice, you will notice how you can blend your English so well that it will become so concise, okay? So after you've done your course and character using your doctor and Socrates, now how do you write out your cause? Remember I said that your positives must come first before the negatives. Imagine my patient came and the presenting complaint was, my patient has chest pain, right, of so duration, cough of so duration. That's the complaint. And then using my 5-6 in my HPC and in my cause. When I see my patient saying they are coughing, I can think of several things. I can say maybe it's pneumonia, can be tuberculosis, and so many other things, right? Let's say in my causes, I'm thinking of pneumonia, and I'm not trying to ask the patient some questions to see whether I will rule in or rule out pneumonia. The patient said they have cough, all right? And I asked my patient, did you notice that your body was hot? At any point, did you get fever? All right, the patient says no. And now ask my patient another symptom of pneumonia. They say no. So that way, I am ruling out pneumonia. I think about the next kind of differential diagnosis that comes to my mind. Okay, my patient said they have cough. So I was thinking about tuberculosis. Okay, Ma, have you ever noticed that in the night you sweat? So you're thinking of drenching night sweat, right? Do you sweat or have you experienced any weight loss? Oh, okay, yes, I sweat a lot in the night. So you're ruling in tuberculosis. Do you understand? So when you're writing your causes, you're going to write something like, oh, there is positive history of drenching night sweat, weight loss, so and so, but no history of blah, blah, blah. Do you understand? So in that case, you're trying to rule in TB, rule out pneumonia. So you're saying something like, there is positive history of drenching night sweat, weight loss, chest pain, but no fever. That's how you write when you're thinking about the causes, all right? You are trying to rule in and rule out several differential diagnoses that's coming to your mind. Okay, so that's that about cause. Moving on, let's talk about complications. Now, in this complication part, you're asking the patient questions on complications of the most likely diagnosis based on the complaints the patient has mentioned. If you are thinking about a particular diagnosis, let's say you are really thinking that it might be tuberculosis. So in your mind, you are thinking about the complications of tuberculosis and you are trying to ask your patient questions about that complication if they've experienced any of those complications yet. Does that make sense? Good. So you're asking questions on the complications of your most likely diagnosis, and you're also trying to ask how the symptom has affected the patient's quality of life. So your complications involves two things. For example, if your patient says they've been coughing so much that they are so embarrassed to go to the office, that's the complication. It's affecting their life, their work life. All right. So in your complication, you are thinking about two things. You're asking the patient questions on complications of the most likely diagnosis, and you're also asking the patient questions about how the symptoms have affected their quality of life. All right. Then about the care so far, which is the final C under our HPC. The care so far is what has the patient done since the onset of illness? Where have they gone to? Who have they met? What medications have they taken? So it must be since the onset of the illness. So for example, some of us, when we have headaches, we just go and buy paracetamol or Panadol and we take it. And let's say, for example, the headache doesn't clear, it is disturbing you, and then you eventually go to the hospital to meet a doctor. When the doctor is asking you your HPC, that care so far, you would have to mention to the doctor that, oh, I took Panadol when it started, it didn't go, right? So that has to be in the care so far. That's the care so far. So has the patient done any self-medication, which most of us do? Not so good. So has the patient done any self-medication? Did the patient go to a pharmacy or a hospital? And where has the patient gone to since the illness started? If the patient says, oh, they've gone to a hospital before coming to this hospital, okay, in that hospital that you went to, what did they do for you? You have to write that down. What investigations were done? Did they take your blood to run some blood tests? Did they do all the kind of things they must have done in that hospital? Did they give you some drugs to treat it? All right, you have to mention it. What are the things the patient has done since the onset of the illness? The treatments, the investigations they've done, where the patient has gone to, all right? Was it self-medication, all right? And if the patient is in the ward, admitted, what are the things that the patient has done since they've been on admission? Understood? So that's care so far. So that's everything about the care so far. And that's how you end your HPC. So your HPC is using 5 C's. Let's say them together. So the character, the cause, complications, and the care so far. So these are the things that it entails, right? And then you arrange it this way. And remember, you're writing your HPC is going to be like in an essay format. You're just writing. You can give paragraphs at some point to make your work presentable. Okay. So HPC is usually where the bulk of the stuff is. Now that we're done with that, let's move to the next part, which is the past medical history and the past surgical history of the patient.